in the title of your talk, you talk about mindfulness, somatics, and core creativity. Can you maybe just describe for us what we mean when we say mindfulness? How can we conceptualize what that is for us?
Well, mindfulness is a form of meditation that was developed by the Buddha in 2400 BC in the tiny village in India of Bodh Gaya, where he received his enlightenment. And shortly after his final awakening, he went to give his very first discourse in a small village with a park called the Deer Park. And the discourse was called the Satipatthana Sutra. And Sati means insight, and Patthana means focused guidance to evoke wisdom. So mindfulness meditation has been being taught and developed from the ancient time of the Buddha all the way to more recently. In the West, we've had what we call the mindfulness revolution. And Jon Kabat-Zinn, who's one of the fellow meditators and teachers that all of us, when we were in India in the 70s, were studying mindfulness in Bodh Gaya and various other places. And so he came back and he went to the University of Massachusetts in Worcester, the medical school, and started to develop mindfulness-based stress reduction, which is taking the Buddhist philosophy in its association to Buddhism out of the way and making it a very streamlined, much more non-sectarian and Western approach. Now, the beauty of mindfulness meditation is that it's very holistic. It addresses your thoughts from the perspective of three categories: positive, wholesome thoughts and positive, wholesome belief systems, neutral thoughts and belief systems, and then negative and what we call unwholesome or painful, afflictive thoughts, beliefs, and also feeling states. And of course, this is where depression comes in. And the usefulness of mindfulness meditation is that mindfulness meditation, it's a tripartite treatment model in the sense of treatment from going deep in discovering the inner workings of the mind. And most depression is both a mind and a body in terms of feelings and sensation. And then there's another category that has to be understood in depression, which is the most difficult, which is we see a lot of forms of depression that we call endogenous, more commonly referred to as genetic unloading, bipolar disorder, depressions that come on early in childhood, age 3, age 4, age 5. I know for myself, I started to experience depression around the age of 6 and 7. And there was no reason for it. Loving home, going to a private Catholic college, private Catholic school that got me into college later. But I, as a child, just organically started to feel that things were off. And so we have the genetic and the brain aspect of any form of depression. And what's very useful about mindfulness is because it addresses the mind in terms of what you think, what you believe, and the body, and this is the somatic experiencing component. Our thoughts may determine what we feel in our body, and sometimes what we feel in our body gets kicked upward into the brain, which then switches on, unfortunately, the neurons in the right prefrontal cortex that are often associated with depression, pessimism, being helpless, hopeless, feeling dark, feeling dreary. In my case, as a young child, I felt this deep sense of melancholiness. And it was almost like an old friend, unfortunately. It was this sense of cloudy painfulness. And I would try to talk to my parents about it, and they just didn't understand. I mean, like, But my heritage is Irish. And so I have 4 grandparents that all come from Ireland, and we have a long line of great poets, thinkers, philosophers, and writers like Eugene O'Neill, Ernest Hemingway. But we also have a great history of melancholy, bipolar disorder, anxious depression, what we call cyclothymic, which is you cycle through the year. Some months you feel really good, and then some months you're all upside down. Mindfulness, what's brilliant about mindfulness is no matter what I'm going through, whether I'm up or, oh boy, the clouds of depression have once again reemerged. When I sit, and I sit twice a day, I also do Tai Chi Chuan and yoga, which I feel, but that's a whole other conversation for another day, which are very, very effective for treating depression. And Bessel van der Kolk, who recently introduced an entire new book, mentions that yoga and meditation are extremely influential in the treatment of depression. The beauty of mindfulness is, as I said, it's a holistic approach. So it really helps you when you're having really dark and negative thoughts to just label them as just that. They're just dark, they're just negative, and they're painful, or what we say, afflictive. You know, the Dalai Lama taught us through the Mind-Brain Institute meetings that it's best to understand everything around depression as an affliction and not one's fault. Unfortunately, one of the side effects of most people who suffer with depression, and I've interviewed thousands of people, is that they feel it's something wrong with them, that it's their fault. That, like I said, I was 4, 5, 6, 7 years old, and all of a sudden I felt this sense of like the fog from San Francisco coming in and filling the bay. And that's part of depressive ideology, which is an inherent sense of something's happening to me. I don't like it. It doesn't feel good. I didn't do anything. And yet here I am in first 8 o'clock class in the 2nd or 3rd grade, and I'm just not feeling all that good. So flash forward to struggling and suffering with depression from early childhood, which is one of the more beastly forms of depression. When I went to university, I walked into a meditation class, and I sat down and I tuned in, and within like minutes, I started to feel my energy and my mind literally opening up, like the clouds or the fog was retracting from the bridge of self of San Francisco. And I started to get, in that very first 5 or 10 minutes of meditating, there's something I can do. Depression may not be my fault. However, it is my responsibility to do something with myself.
Well, it does sound like, I mean, you've touched on this idea that we have this interchange happening between what's going on in the mind and what's going on in the body, that they're communicating with each other. And also that I think it is very common for depressed people to identify so thoroughly with their dark thoughts. This is just the idea that you are not those thoughts, like that hopelessness that you're experiencing, that sense of pushing down, or, you know, just all of those dark things that can come out of being depressed, that is not the same as the person that you are.
Yes.
Yeah, you know, and I think maybe that's, and again, you tell me how this works, but mindfulness can help you separate that?
Yes. The process through mindfulness meditation, and this is also true in a different polar opposite of mindfulness meditation, but they both deliver you to the same place. And that's the Vedic Advaita non-dual. Another way of, a colleague of mine, Locke Kelly, wrote the book, Effortless Mindfulness. So from the non-dual perspective, you sit in meditation without effort. And then in the process of sitting without efforting, there's oftentimes that dispersal in the immediate sense of,
Mm.
is there really a problem to solve? And what would I be like? And what would my mind be like? Whether it's through mindfulness practice or the non-dual effortless mindfulness practice. If I disidentify that there actually is a problem, in over-identification further compounds the experience of depression, because we're overly identified that I'm depressed, rather than what's really so is in America alone, there is 28.6 million types of depressive disorders. That's reported. So if you really think about addiction, substance abuse, alcohol, it's probably 3 times that, because you have the other 2/3 who are actively trying to self-medicate their depression. And then you have another 24.2 million forms of anxiety that often lead to anxious depressions. The beauty of mindfulness is that you learn to disidentify that it's me, that I'm depressed. Something I oftentimes say to my patients is, well, who would you be if you let go of the depression? And what is and who is the self that's currently experiencing the depression? So if you can create that witnessing awareness and to have the part of consciousness through meditation separate and look back on the person who is depressed, oftentimes that disidentification and that sense of spaciousness, all of a sudden a person snaps out of the repetitive quality of the depression. And again, if we go back to thought, one of the most painful aspects of being depressed is not only do you feel physically lousy and off center, but you have a part of your mind that's usually telling you you're not any good, you're worthless, you're a piece of garbage, and on and on and on. That part, though, we can effectively, again, in a laser-like way, we can bring in what's called mindful witnessing awareness that can watch and look. And in that watching and looking, there's a dissolution. And oftentimes immediately, and other times it takes days and weeks and even months to really work through depression with mindfulness.
So it actually allows you to create that sense of separation that, as
Yes.
I'd asked you, right? So you are not the thing. You are separate from the thing, and that allows you to actually work with it once it's a little bit away from you.
Yes, and in that separation, the part of the working with the depression or the self is asking questions like, who is depressed? What would you be like a month, 6 months, a year in the future if you were not depressed? What is the texture or the quality of your depression? Is it mild? Is it medium? Is it severe? What kinds of images or colors do you associate with depression? So one of the things that I do as a working tool is I can fairly just generalize. Most people will say, in brief, black, dark, gray, miserable, those qualities of depression. And then I'll come in with, and what we do in mindfulness theory, from the ancient text that Buddhaghosa wrote called the Visuddhimagga, is there's a quality of, you take the negative, painful, unwholesome thought, feeling, or sensation, and you come up with the positive, wholesome antidote remedy. So the opposite of dark I'll ask a patient to manifest that in light, dreary, sunny, gray, blue, miserable, joyful. And so you have them move from the unwholesome, afflictive thought, feeling, or energy sensation, and you pair and match the positive, wholesome antidote, and you have them meditate on moving. And what I do is I created this meditation. It's called the From Right to Left Shift, the mindful right to left shift for the prefrontal cortex, because the right frontal cortex, as I said before, houses pessimism, helplessness, and hopelessness, darkness, dreariness. When we've studied with PET scans and CAT scans the neuroscience of brain physiology, when you take, whether it's a beginning mindfulness meditation or an advanced Tibetan monk of 30 years, they create a right to left shift. Mm. And what I'll ask patients to do is to meditate and sit and actually visualize moving from the right prefrontal cortex over to the left and hanging out there in the visualization of each and every one of those positive, wholesome antidote remedies. So what we're doing is we're taking a 2,400-year-old practice as cultivated by the Buddha and disseminated to his disciples, and we're bringing it all the way into the here and now, oftentimes pairing it either with cognitive behavioral therapy, or in my practice, I do a lot of work with somatic experiencing, because I work a lot with trauma and individuals, whether they have what we call small trauma or big trauma, T-trauma, big T, small t, is depression is one of the symptoms. Post-traumatic stress, anxiety, and depressive disorders accompany both small t's and big T's. And what we do in somatic experiencing, which is we take the backdrop of mindfulness and we apply it accompanied with the breath. So we track people's nervous systems as well as tracking their unconscious. And we use mindfulness by pointing out in a very simple and reflective way, are you aware of your breath? And a common thing for people who are depressed is they're holding their breath, because they're just holding on, and oftentimes filled with fear and lots of anxiety. Another thing that we do from both the mindfulness and the somatic experiencing perspective is I ask, would you be willing to view your depression not as a thing, but as a series of constrictions, constricted energy flows that are connected to constricted feelings like anger, rage, grief, loss, sadness, sorrow, and emptiness. So when someone says, I'm depressed, after acknowledging that, okay, you feel really depressed, let's see if we can look at and identify what qualities, what flavors of affect, what flavors or streams of emotion are blocked up inside of you and are causing your nervous system to not flow and function properly. Once I pair mindfulness with the breath of somatic experiencing, you find that people start to sit up differently. They start to be less identified with their thinking. They start to be more open to changing the way that they're breathing, which is creating constriction and restriction. And what we're doing in somatic experiencing is we're starting what we call energy wells, blockages of emotion and affect. And we're identifying where in the body do you feel blocked or stuck, and then getting the energy to oscillate. So you see, depression is like this.
You're locked
But
up.
that's
Yeah.
right. But if we can get one emotion or one thought identified, then we start to open up.
Right.
And then over time, with more breathing, there's more movement, and then there's more feeling.
Yeah.
So you think of a triangle: breathing, movement over here, and at the top of the triangle is feeling. Inside the triangle is the experience of the self.
Mm.
Prior to breathing, inside that triangle is that locked and stuck and constricted sense of the self. That's why oftentimes people will view depression as like a thing. I'm depressed, like a pathological statement towards the self. And it's important to interact and make contact with, well, you say that you're depressed. I get that. Can we begin to locate, or are you curious about exploring, what are some feelings and emotions that are quite maybe not at the surface, that might be pulling you down, like the undertow in the ocean pulls you down under the waves?
So then this method is not only separating them from the state of being that they've been in, but it's opening up, as you say, it's unlocking that sense that this is the way things are always going to be and always have been, and nothing can change. And because you do get that sense that nothing can ever change or get better, and that starts to sort of tease out that shift of energy that needs to start to come, so you can continue to make steps in that direction. Is that right?
Yes, yes. And so we go for that opening up and getting what I call the patient to begin to feel a sense of vibrancy and ownership, that they can actually begin to create some movement of cerebral spinal fluid in their spine, in the back of their brain, which is when you start to use hands-on work with somatic experiencing for depression, you start to gently rock various parts of the body, like even the shoulder, or you rock the ankles, or you might rock the side of the pelvis. Once you get that movement going on a physiological level, it has a psychophysiological effect. So they start to experience, at the very base of the spine here is what's called the vagus nerve, the 10th cranial nerve. And the 10th cranial nerve is the central command. It's the central control system of your entire central nervous system. So you want to get some movement all along the spine with depressed people. Now, one of the things that I just want to throw in real quickly that's important is when people tell you that they're so depressed that they're not only thinking of committing suicide, but they've got a plan, or they feel so hopeless, the only pathway that they see, because let's say maybe they've tried a bunch of therapy, or they've tried psychiatric medicines. It's really important, particularly now, that the legalization of the use of psychedelics like ketamine, psilocybin, MDMA is coming back into legal use. Now it's in Oregon and in Colorado. That I think it's really important to be able to hold out that, hold on, I want you to try some things. And I've done this. Because I'm not licensed to do it, I've suggested, and people go to what are called trained somatic sitters who guide people through this. But I've had 3 people in the history of my practice who very clearly said, I'm going to be taking my life. And one was a 28-year-old woman. And I arranged for her to have 3 sessions with MDMA. And that woman today is a esteemed psychoanalyst.
Wow.
And that's just one of 3 stories. And I've got many, many
Well,
stories.
yeah, and we certainly are having conversations in this summit around the issue of psychedelics and how it can be helpful. And I'm so grateful to you for bringing that up. If you don't mind, I'd love to ask you about this kind of third pillar of the title of your talk, which is around creativity. We haven't really gotten to that yet, but that's a subject that's close to my heart. And I know that I'd really love to hear how that can be useful as a tool and what it is that you mean when you talk about creativity or core creativity.
Well, Allison, thank you for bringing that up. I have a brand new book out called Core Creativity, The Mindful Way to Unlock Your Creative Self.
Mm.
And so I interviewed for the last 46 years, many, many creatives in the television, film, music, the .com industry here in America. And I interviewed 10 notables for the book. And then I did a series of years and years, decades of research on depression and its influence on creatives throughout history. And one of the fascinating things that almost everyone that I interviewed, as in many of which of whom I also researched and studied that other people interviewed historically, is I had the opportunity to talk to the late, great Leonard Cohen,
Wow.
musician, poet, fellow Zen meditator here in Los Angeles, musician extraordinaire.
Mm-hmm.
And he's always historically been very public that he suffered with depression his entire life. Mm-hmm. And here's a guy with, the greatest musical achievements and songwriting ability you could ever think of. And so I said, Leonard, was depression responsible for all of your creative expression? And we were sitting and he looked up and then he looked inside and he rolled his head like this, said, no, Ron, depression was the sea that I swam in a lot, but my creativity came from when the waves of depression would pop me out on the sunshine of the beach. That's when I would start to create. So mindfulness frees up a lot of that depression, which then sets in motion your capacity to be more creative. Some people, in particular musicians, for example, blues musicians, will tell you that when they get down, they get much more prolific in their musical writing and playing. But most of the filmmakers, the actors, people, artists and painters, they all said that their greatest expression came after the depression. So I think it's important to note two things for everyone listening. Mm-hmm. There's gold in one's depressive states.
Absolutely. Absolutely.
And second, many of us who are highly accomplished at all walks of life struggle either daily or monthly or 3 or 4 times a year with feelings of depression.
Yeah, it's not always so obvious on social media that people are dealing with stuff, right? Yeah.
Right. But as I said, I've interviewed thousands of patients struggling with depression, and some who are just prolific in their fields, judges, politicians, famous musicians. Mm-hmm. And they all say that what's important is to embrace when you're down, be down. Mm-hmm. But mindfulness teaches us, again, disidentify and don't stay too long in the down state. And how do you do that? Well, through that process of cultivating the witness awareness, which will separate and give you some spaciousness from the I, that I feel depressed. What is really so is depression is present. I is when I internalize that. If I get on the phone and I start to talk to a friend or a colleague and say, I'm feeling depressed, within 1 or 2 minutes, I'm already starting to feel better. And if it's a mindful meditator colleague and they get me to disidentify, in 5 or 10 minutes, there is no depression. Mm-hmm. I was depressed, but in the over-identification. of
Right.
I, me, and my. This is my depression, as opposed to that there are depressive waves of energy, just like thought. I ask every depressed patient, where do you think thought comes from? And do you think your thoughts are unique? And people will start oftentimes to smile and go, I just think I'm the only one that has really bad, negative, depressive thoughts.
Yeah.
And then we get into a whole conversation about, well, what if thought is just ever present in the universe and you're just tapping in to negative thinking, which is causing you to emotionally to feel depressed? And what would it be like if you started to meditate once or twice a day so you could disidentify and you could drop into the field of all thought and just see that thought and negative feeling, it's just flowing through the universe.
So,
Take yourself,
go ahead, please. I mean,
take
I do
yourself
have a
out of the
question that, go ahead.
take yourself out of the stream, you see, and that's what mindfulness is. The stream is filled with lots of uncontrollable thinking and unwholesome feeling and unwholesome sensation.
Yeah.
But when you start to meditate, you're sitting on the banks of the stream or sitting on the banks of the river. And now you're watching all that distress float down and hopefully away.
Mm-hmm. So I love something you said a moment ago about how you can find treasure in these moments of depression, and that really resonated for me. And so what I'm wondering now is, is it possible through this mindfulness meditation, through this kind of methodology, to when you're in the process of separating yourself from that depression, making it something that is distinct from your own identity, could you have a dialogue with your depression almost and say, okay, what is it that you're here for? What do you have to teach me? What is this boon or treasure that I can bring out of this experience? I mean, can you even get it to that level where you're seeing what it is that it has to teach you as a teacher instead of an adversary or just something that's going to push you down?
Yes, brilliantly said. You covered many of the points in it already. And so I'm just going to add to some of your own brilliance, which is if you see depression and you experience depression as an adversary, you're going to be fighting it. And you're going to be fighting against the stream. If you welcome depression in as an old friend, and as I said, I have an old friend who started at age 4 and has been with me, and I'm age 72. It's an old friend. It comes and it goes, and it comes and it goes. However, when it comes, there's a gold. And gold is an alchemical element.
Yeah.
Lead, which is representative of darkness, depression, heaviness. In alchemy, we transmute to transform lead into gold. And you used a wonderful term, which is the boon. The boon is a gift.
Yeah.
Instead of looking at, oh, here I am, depression's coming again. For example, for me in the fall, it's hard because I love spring and summer because of the light. And that's my better times of the year emotionally. But the fall is also a great time for meditating more. And then the more that I meditate, the more I can create disidentification and mindful witnessing, and then spacious, non-dual awareness. And so mine into the gold because, for example, take the prolific singer-songwriter John Lennon. When the Beatles broke up and he was going through a very, very difficult time, he comes out with his very first album. In one of the songs, it's called Mother. And he's doing Primal Scream. And the whole rest of the album is infinitely, exquisitely beautiful, the vocals, the lyrics. But in one of the very first songs, the Mother song, he's primarily screaming because he's depressed. But he works through with the primal scream, he works through his depression, and then he's able to go on and to write. And then in the next album, he writes his masterpiece, Imagine. So we need to respect and appreciate that depression, even though it's painful. I mean, When I'm depressed, it's so painful. When I'm happy, I'm really, really happy. We need to accept that, though, as what the Buddha called, that we have karmic imprints. In Hinduism, we call it samskaric patterns of thought, feeling, sensation. And those samskaric patterns are responsible, for example, sometimes people have alcoholism, or they have drug addiction, or they have gambling, or they have porn addiction. And depression is a symptom of most of that type of behavior. If you take those behaviors away, what comes to the foreground first and foremost is depression and emptiness. But there's a tremendous opportunity in harvesting and going into the darkness. In India, the most beautiful flower, and every time I'm in India, I always say, take me to the lotus pond.
Lotus, of course, I knew you were going to say lotus.
Yeah, and the lotus flower grows in a mud pond.
Right, right.
And so it's the juxtaposition. There's your depression, but a lotus pond doesn't look at mud as depression. It looks at it as fertilizer.
Right.
And that's what I suggest that we do. And I've done my whole life I've had great bursts of creativity following very dark times. And fortunately, in the last 3 years, with my new book, I wasn't in a dark period, even though it was the pandemic. I just enjoyed not traveling and having tons of time to meditate and see friends and to write my book. And then
you're prepared for that, though, because you had done all this work for so many years. Had you not done that, you might have found it a very different experience to be in the pandemic. And I think a lot of our folks have maybe kind of experienced that. But I thank you so much for talking with us, and I've learned so much from our conversation, and I know our listeners certainly will too. And it hopefully will give them a chance to check out mindfulness meditation, the somatic work that you're discussing, and exploring their creativity, because I think that can help absolutely. So I know we've talked about so many wonderful things. I would just like to give you the opportunity to share with our listeners how they might follow up with your work. We mentioned your core creativity book, but what are some other ways that they might connect with you and learn more?
All right. Another one of my books is called Wise Mind, Open Mind, Finding Purpose and Meaning in Times of Crisis, Loss, and Change. And you can get that on Amazon also. Mm-hmm. And that's a wonderful toolkit for working with everything that we've been talking about. I have like 20, 30 meditations and antidote remedy exercises. And then my website is ronaldalexander.com and corecreativity.com. And I have workshops and trainings and lots of journal articles for free that you can download.
Oh, that's wonderful. Thank you so much for sharing your expertise and your wisdom with us. And I know, as I say every time, we've covered so many wonderful things in the last few minutes. And I just want to invite everyone to hit that button at the bottom of your screen, and that will allow you to upgrade your participation in the summit. And it'll give you access to this conversation and so many more as far into the future as you would like. You can come back as many times as you need to and re-listen to my conversation with Dr. Alexander. Thank you for joining us here at the Stop Depression Summit, and I will see you for the next one. Bye, everyone.